Good evening all. Myself Kamlesh, I am from Apollo Hospital, Chennai. He is the Dr. Sudeepta Kr Swain. He is one of the senior most surgical gastro surgeon in our Apollo Hospital, Chennai. His expertise in laparoscopy and robotic is most interested part on that. So that part I just pass the things to Dr. Sir. He will share his experience. He will share his expertise to all of you. Sir,
yeah. Good evening all.
1 minute.
Dr. Sudeepta Kr Swain is the head of the Department of Surgical Gastroenterology, Apollo Main Hospital. So my expertise is in surgical gastroenterology, which is like from chest, food pipe to stomach, liver, pancreas, and even the colon, rectum, and the other organs inside the body, except the kidney, uterus, and other reproductive organs. So we do minimally invasive surgeries starting from laparoscopy to robotic surgeries, even including the complex cancer surgeries of the intestinal tract, liver, and pancreas. And we are a high volume center. As you know, the Chennai Apollo Main Hospital is the #1 gastroenterology center in India for last many years, and we have the best infrastructure, which includes multiple robotic systems, the best critical care support where we give peri-operative support to the patient. We have the best medical oncology unit, the proton therapy, which is the first in ASEAN region. So why I am here today is mainly to inform and help people. Like, we see patient, treat patient, operate patient in Apollo Main Hospital, Chennai, and the centers like Proton Center. But this patient need regular follow-up. So follow-up, this patient cannot come regularly to Chennai, which is quite far from here, and with this patient and with attendance, it is cost-wise also is not feasible, and it is difficult for them to travel again and again. For that, we the senior doctors like me come to Apollo Trinity Medical Centre in Shillong, where we can see those patients and give them advice, listen to their problems, and whatever the concern, the anxiety or the issue is there, we can resolve that. Here there with some diagnostic facility also, which is Apollo standard, which can be done here. If I need a we get an ultrasound done and come back, get a blood test, come back, it can happen in the same day. I can see them and I can advise them. Not only that, new people, like I have a problem but nobody is able to answer properly in Shillong. I have seen 5 doctors but nobody is giving, and today I saw one lady, I'm not naming, but she was going around and she was not getting a good advice what exactly she has to do. So those patients, we can diagnose what exactly, or get an algorithm for them. These are the things you have to check. This is the probable diagnosis. This is my experience of like 25 years in this field will help them to tell what exactly they are going to have, what investigations. If the investigation can be done here in this center, it is good. They can do that and follow with me. If required for complex assessment, they can come to Apollo Main Hospital and Apollo group of hospitals in Chennai, which this center will facilitate. Means they will follow how the appointment will happen, how the vehicle will be arranged, free vehicle for the patient, how the doctor will see the patient early there in Chennai, because Chennai is a very hospital crowded place. They may be lost there, language problem is there. So which they will coordinate from here. Every movement of the patient will be coordinated by this center, and they will ensure that we the senior doctors are taking care of the patient who are coming there, getting earlier treatment and coming back easily and following them. Suppose I am not there, I am coming every 1.5 months, 2 months. I will come regularly, but in between patient has some problem. So whom they will reach? So they can reach them easily. This Apollo Trinity Medical Centre, where they can pass on the message, discuss with me, make an arrangement of a teleconsultation with me, so that their anxiety is immediately resolved on the same day. So otherwise you come get a consultation, you think that doctor has gone what to do. So this all type of connectivity, facilities, helping them to get an assessment, getting the diagnosis and algorithm of treatment, getting to a higher center, the best center in India, to get complex work done, be it a pancreatic cancer or esophageal cancer. Centers are there in different parts of India and nothing, but we always choose the best. If you look for the best, then you have to think of the best hospital in India. And the prices, we think that it will be very costly, and it's not. All corporate hospitals are charging the same, because it's a private hospital. There will be some cost by the hospital, so that patient has to pay. And we always consider cost cutting whenever possible. We help the patient, we give concession, discount always whenever we feel the patient is not affordable. We do that also. And then my request is to all, if you have any issue or particularly gastro related issue which is not looking simple to you, or you have anxiety, or nobody is able to diagnose, come get the expertise, get the expert opinion here in Apollo Trinity Center, and see how your experience is, whether your problem is resolved or not. If you have any issue in between also, we are ready to connect you and resolve it. That will be big help for the patient around Shillong, and we'll be continuing coming here regularly every 2 months to help these people and at their place. I'm from Bhubaneswar, but I always feel the patient should be seen at their place during the follow-up, even for the initial diagnosis, which will help. Thank you.
Can you tell us what is the status of Meghalaya patients? What is the nature of their sickness since you are dealing with them? How acute it is?
Which patient? The patient which
coming from Meghalaya. Yes.
See, acute patient means somebody is having a acute severe pain. He cannot travel, sir. Normally he won't be travel. First he will be stabilized here. You will see, if required, they can have a teleconsultation only. Because acute pain, how he will be able to travel? Either he has to be airlifted or he has to go by special. But usually what they get an advice. Then once their pain has come down a bit, they come for the definitive treatment to Apollo Hospital. There we see how is the investigation done, with the need special investigation to be done, and it doesn't take time. Within 1 day mostly we get all the investigation done and get the assessment complete. Regarding the type of patients, sir, what you are telling, we get many cancer patients from this region and northeast region, where like starting from chest, food pipe, the stomach, colon, even pancreatic cancer. And we have treated some patients. Today also I saw a few of my old patients who have been operated by me, and they have come for checkup. And these are the main patients what come, because smaller issues they won't travel so much, and it is not required also. Mainly when the tissue is not resolved for a long time, or you have a major issue like a cancer issue, and you can travel there to get the best treatment. And you have a confidence that there is a center in Apollo Trinity Center here which will help us, and if required we can go and immediately talk to them, and not only that, the doctor comes here. Doctor will see me every 2 months, he will see me. So this is the advantage, even if we are dealing with a cancer and operating a cancer.
Continuing with this question, you said the majority of the patients from Northeast are cancer patients.
What we receive.
Yeah. So do you think that any specific reason could be there behind so many patients coming with cancer cases?
There are few things which we are correlating, like the lifestyle. We have like taking excessive red meat, one. Yes, sir. And second thing, taking repeated or high volume of hot beverages. Okay. Not only hot beverages, the alcohol intake also, and the smoking. If you take like alcohol, somebody is taking only alcohol, there is some damage. But when he takes alcohol with smoking, that it gets multiplied, not 2 times, it becomes 10 times damage. So those things, one is your food, lifestyle, the hot beverages, alcohol with smoking, maybe because of cold weather. So this all increases the incidence of cancer in this region. Of course, there is a background genetic changes will be there, but environmental factor plays a big role in Northeast, which increases the incidence of cancer. What we can control, I can advise is like make a good healthy lifestyle. You take lot of fresh vegetables. You take non-veg, not a problem, but not like only non-vegetarian diet and red meat. And avoid smoking and taking alcohol. It's not must to have. Somebody is taking once in a while in a month is but taking every day morning and evening is not right along with smoking. That is what I can advise.
Coming words in 2 months
Yes, sir.
for sake of patients.
Yes.
So my question is this: whether this hospital is not having any local doctors to help patients in your absence.
No, they have local doctors, sir. They are having local doctors. This is new. They are getting into, and they will have local doctors who will be coordinating and treating like the common elements. We'll have common elements like I have gastritis. Mild gastritis happened first time in my life. So there will be local doctor who will be coming to the center and dealing with that. But major issues only they will be dealing with us. We are not here to deal somebody's like just a muscle pain or just a, like a starting one day of gastritis. We are not for that. We are here mainly for issues which are prolonged, issues which could not be diagnosed, issues which are complex.
So means more or less we can say that OPD is here.
OPD is here, sir. We in our absence also they will have OPD. Today also I met one local doctor was here. So that is they will be running that. Sir, government collaboration mainly what Apollo has mainly for projects like we are doing a particular type of disease we are following and we are treating them. We get some maybe fund for the government, but routine running and operating the patient and treating, we do not have such major things where we get support from the government. It is all the cost which Apollo bears. That is why the patient pays. And insurances, you take any insurance available in India, everything is approved by Apollo. Long away this question, not now. I have got this like 5 years ago regarding Apollo. We are trying to have government. Actually, the center is very flexible now to have a tie up with private hospitals and make the treatment cost effective so that the patient don't have to pay much. So we are trying to find out, not yet finalized, like a bridging, not like a complete Swasthya card where the government has to pay, not like a complete private. In between, if can get, the government has to pay some subsidy and we can operate. Yes, it is happening for few things like transplant. Transplant we are getting government aid in some of the governments are giving and we are paying like the patient is paying partly. So that is helping. So it will come up in future, sir. It has to be. The required amount. So WHO has recommended certain percentage to spend in health budget. Till now, no government has spent that. Okay. So if you spend that much for health budget, automatically it will come to even the private. Now presently 70% of our health management is by private sector, 30% by government. So 70% we hope either it will be a hybrid thing where government will be having collaboration with private, or it will be slowly government is making like there are certain countries like Sweden or even private hospital, patient will get operated, the money will come from the government. So that is how it runs. So hopefully one day it will happen. Sir, I am from SC Medical College, Kotak, my MBBS and MS. But if you take SC Medical College also, the MRI when they took, it's a government hospital, complete government is the first like 1920, they that time the medical school then became college. There also they had the MRI with a collaboration, so that the cost doesn't, the government don't have budget, so it is okay, but they can get some private help, so that the cost, even if you get the best technology, little bit of cost patient has to pay, rest is given by the government. It is happening, it will happen more in future, and the region government is flexible and is helping a lot. We should ask that, see sir, why the Apollo is a, we just blindly don't say it is a brand. Apollo has the highest network of hospitals in India. It is like 73 plus hospitals and there will be thousands of clinics and medical pharmacies and different centers. So when you have, why this is growing and having a good network is the main thing starts with quality. We always try it can varies from hospital. In the same system also different hospitals are different. We have a Guwahati Apollo, we have a Chennai Apollo hospital, but the Chennai Apollo hospital main cannot be compared with Guwahati. It's a different setup and different way of taking. That doesn't mean Guwahati is nothing. Guwahati has a good start, but it comes to the top like Chennai Apollo. Why it is people are still going to Chennai Apollo hospital? Because of the standard of care. What standard of care you are giving? What infrastructure you have? Tomorrow I can challenge you a patient I have seen one thing like a road traffic accident patient. If you have a road traffic accident, what I have seen in my eyes, in Chennai, give a call to 1088. In 1066. So in 10 minutes I have seen the ambulances everywhere. They spread across the Chennai city. Not that it is ambulances in a hospital. You see ambulances stationed in places where nothing is there. In national highway, in different corners. The moment you say there is a road traffic accident, 10 minutes it goes, and the paramedicals which are there, they know how to do the initial management. By the time it reaches the hospital, the emergency room is ready. There is a dedicated emergency room to deal with road traffic accident which is ready. It comes if required, they intubate, they give the blood samples, they give the blood to the patient. Within required half an hour, the patient will be in operation theatre. That type of fast network, this is not just for the press conference I am telling, I have never seen. I have seen different hospitals. The way of giving the care is fastest, and who is available? Sir, you go to any hospital, a cardiologist. You call at night and go a cardiologist. You may not, you will see the junior most doctor in corporate hospital. But Apollo, Chennai, you see the senior most doctor available at night 2 o'clock to see you. Same as you give me, I am working, I am the head of the department, my experience is so much, I am so senior, I won't have to run at night. But if there is a complex patient in emergency room at night 2 o'clock, I will be there. I will be there directly to see, so that the patient, we don't lose the patient. Lose the means, lose the life of the patient. I am not telling losing the patient to other, lose the life of the patient. We give priority to that. That is why we have the name. Cost is there, sir, everywhere. It will be varying. Somebody will be charging 18 rupees, somebody will charge 19 rupees. But the quality of care, we are known for that. That is why we are telling that Apollo is the best. Not college, running a medical college is a little different than running a hospital. Apollo has medical colleges, Hyderabad and Nellore. So they are coming to trying to find ways how they can increase the number in different parts of India. Because running the medical college, we need to maintain the quality of not only the teaching, quality of the treatment also. Because if you see the medical college, which is always has to be with a good hospital. Medical college doesn't run without a good hospital. It has to be, because how the training will happen. So you need to have a good hospital and run a medical college, and the number of faculties what required for a medical college is huge. So we should not dilute the treatment. Simultaneously, we should maintain the teaching. That is why Apollo is not, like till now it has not spread the number of or increased the number of medical colleges, but in future, since 2 medical colleges running successfully, we will be getting more. See, when a medical college, even any hospital starts, let it be Apollo, Manipal, Fortis, whoever is starting a hospital, it always starts with the outpatient department. It never starts an inpatient directly. We always start with the outpatient department, diagnostic facilities, treatment and all. And once that get established and running smoothly, then we think of starting inpatient. Because inpatient care is not just like that, okay, it is the number of beds or put some beds. We have to have round the clock investigation, doctors who are there to treat, operating person at night, all this. So it will happen over time.